Imagine a machine that could tell you when you'll die. Not a psychic, not a doctor, just code. A neural network running quietly inside a hospital server, sifting through millions of lines of medical data and predicting the end of human lives with eerie precision. Researchers once called it predictive analytics. But inside sterile labs and humming data centers, something stranger has emerged. An algorithm that sees patterns of life and death hidden deep inside the numbers. In 2019, scientists at the University of Nottingham created a machine learning model that could predict whether a person would die within 5 years, with nearly 90% statistical accuracy. It analyzed 500,000 medical records from the UK Biobank and found patterns invisible to any doctor. The system wasn't told how to diagnose disease. It simply learned from the outcomes in the data. It connected signals no human could explain. Small chemical imbalances, subtle shifts in behavior, clusters of unseen variables, and from those patterns, it calculated risk with remarkable accuracy. Soon, other systems followed. At Mount Sinai Hospital in New York, researchers built an algorithm called Deep Patient that trained on more than 700,000 hospital records. It could anticipate which patients were most likely to develop serious illness or die, long before doctors recognized the warning signs. In Google's deep learning labs, another model learned to estimate hospital mortality hours before traditional monitors changed. In study after study, these systems began outperforming physicians at one task, predicting who was at greatest risk. Machines, trained only on data, could now perceive something we couldn't: the statistical shadow of death itself. So the question isn't whether artificial intelligence can predict death. It already can. The real question is, what happens when we let it? To understand how a machine can foresee death, we have to step inside the code. Neural networks mimic the way neurons in the brain fire together, finding relationships hidden in oceans of data. At Mount Sinai, the Deep Patient model did something remarkable. Without being told what to look for, it identified early indicators of disease that hadn't even been named yet. The algorithm couldn't explain what those patterns meant, only that patients with those same fingerprints tended to get sick or die soon after. That's the paradox. These systems don't understand health, but they can forecast its decline. They only calculate. Once an algorithm can predict death, a disturbing question follows. Who has the right to know? If a hospital's artificial intelligence quietly flags you as high risk, should your doctor tell you? Should your family know? Should your insurance company? Or should the prediction stay locked behind a wall of code? Could you live normally knowing that a machine sees something in you, a signature of mortality, that even you can't sense? Some ethicists say patients have a right to that information. Others argue it could cause unnecessary fear, depression, or even fatalism. If a doctor sees a high death probability, would they unconsciously treat that patient differently? Then there's the darker side. A health insurer could quietly raise premiums for those flagged as high risk. A hiring system could eliminate candidates whose data suggests poor long-term health, all without ever telling them why. This isn't as far-fetched as you think. The story didn't end in research papers. In the United States, one of the largest hospital software vendors, Epic Systems, introduced an early warning AI designed to predict in-hospital death and sudden deterioration. It runs silently behind electronic health record systems, scanning vital signs, oxygen levels, and lab results in real time. When the numbers cross certain thresholds, it alerts staff before the crisis begins. Google's DeepMind developed a similar system in the United Kingdom, analyzing millions of patient records to predict acute kidney failure up to 48 hours before symptoms appear. But while these systems are built to save lives, they also collect them in data form. Every scan, every heartbeat, every admission becomes another record in the growing digital archive of humanity's health. And private analytics companies now license de-identified medical datasets to pharmaceutical firms, insurers, and research startups. A patient's future, distilled into a percentage, is more than a diagnosis. It's a data point with economic value. The technology meant to protect us is spreading faster than we can decide what limits it should have. For centuries, humanity has wrestled with one mystery above all others: the moment when life ends. If you could know when you'll die, would you want to? Now that question isn't spiritual anymore. It's technical, and the answer might live inside a line of code. In hospitals around the world, machines are calculating mortality risk in the background. They just output a number, a percentage that means, in effect, how likely you are to be alive 5 years from now. It sounds cold. Ancient Stoic philosophers believed that remembering death, memento mori, was essential to living well. If an algorithm predicted that you have limited time left, would that knowledge make you live differently? Would you love harder, forgive faster, or would you feel trapped, haunted by a countdown you can't see? Some people, when confronted with their fragility, become more present, more compassionate. Others retreat, paralyzed by fatalism. And yet, that's where AI has led us, to a mirror held up by mathematics. It shows us that everything we do, every habit, every choice, leaves an imprint that can be measured, modeled, and possibly foretold. Because once we realize the future can be calculated, we have to ask, what happens to free will, to mystery, to meaning itself? Maybe it's that, once we ask it, we can never unknow the answer. Every technology that can predict the future eventually tries to shape it. Today's predictive AIs don't just forecast who's likely to die, they also reveal what choices make survival more probable. Diet, sleep, movement, stress levels, even social habits, all become variables the machine can weigh. Already, health apps and wearable devices collect billions of data points each day. Imagine a future where your health insurance premium adjusts in real time based on your smartwatch readings, where an AI system can predict not only how long you'll live, but how much that life will cost. These systems don't need to be malicious to change the balance of control. That's why the rise of predictive AI isn't just a story about technology, it's a story about power. The power to decide who gets treatment, who gets coverage, who gets a chance. Because the moment we let a machine predict our end, we surrender part of what makes us human, the right not to know. If this video made you think, if it stirred something in you, leave a comment below. Like and subscribe and share this with someone who still believes the future is theirs to shape, because the future is watching, and now it's listening too.